Assalamualaikum and hi everyone. My name is Wan Ahmad Irfan bin Wan Abdul Sani and my metric number is 2019200472. Today our group represent about the Ministry of Health of Malaysia. Let's go first for the introduction. The Ministry of Health or Kementerian Kesihatan Malaysia, or also known as MOH or KKM, is a Malaysian government ministry which is there in charge of health related issues that contribute in the country. They were responsible to take care of the health of the citizen and had promised to give the best service for the citizen. Example of the service that provided by the KKM is to give the citizen public health, medical research, medicine, dental care, and many more that related with health. Because the Ministry of Health was also involved in the rehabilitation of concerns and community development, the Department of Social Welfare was placed under the Ministry of Health twice from 1656 to 1657. During the merger time, the ministry was known as the Ministry of Health and Social Welfare with B. Datuk V.T. Sambatan as its first minister. However, the ministry was renamed in 1963 with the fourth minister Y.B. Datuk Abdul Rahman Talib from the Ministry of Health and Social Welfare to the Ministry of Health, back whose name is being used until today. Through the Ministry of Health and a number of other government departments, the Minister of Health conducts minister functions. This agency's objective is to ensure that the country mobilizes energies toward the greater health and the mission is to lead and collaborate. The Minister of Health administration ministerial functions through the Ministry of Health with a range of other government agencies. Currently, there are 280,000 people of civil servants in the health sector to help provide a smooth and best service to the people. The Ministry of Health Malaysia will continue to expand with new health facilities being added each year.
Assalamualaikum, my name is Nino Marsha Maisara binti Nik Maznan. I will be the one who present the activities of Ministry of Health. Medical programs' primary responsibilities are to provide the best healthcare services in any Ministry of Health hospitals. Medical program also plays an important role in improving medical systems. The first activity is preventing premature death, decreasing disabilities, and disease prevention. For example, reorienting health service that emphasizes accessibility, health promotion, and effective management of chronic debilitating illness. The second activity is providing training for medical officers and continuous professional development CPD for medical doctors. For example, through Malaysian Allied Health Profession at Council MAHPC. Next activity is integrating traditional and complementary medicine methods in national healthcare system in order to provide holistic and comprehensive care to all people. Other than that is regulating services and facilities for psychiatry. Some actions are conduct a practice for medical officers, opticians, and also medical aesthetics. For example, through mental health care at 2001. Next activity is medical aid fund. This activity acquires financial support from the government to purchase medical equipment, rehabilitation equipment, and many more. For example, funding and remuneration of expenses.
Other than that, In the 10th Malaysia Plan, the Ministry also introduced policies to control HIV and AIDS. The Ministry of Health has launched the harm reduction program that combines methadone, maintenance, MMT, needle and syringe exchange program, NSEP, and condom use to prevent HIV infection among intravenous drug user, IVDU. In Africa, with the support of government organization, a harm reduction plan was implemented to promote community participation, the acceptance of certain risk group. This program will strengthen specific risk group related to HIV transmission and prevention method. There are also a measure designed specific for the public at risk of infection, and voluntary HIV testing is carried out in health clinic across the country. This will motivate group at risk to try to obtain enough information and skill to protect themselves from infection. Back in 2019, Malaysia at that time was ruled by Pakatan Harapan government, and the Minister of Health at that time was Dr. Zulkifli bin Ahmad. During this period, Dr. Zulkifli implemented too many plans and projects at the Malaysia Ministry of Health. Some of them are drug price control, PKB40, mandatory vaccination, electronic medical record, smoking bans, and many more. The smoking ban will take effect on January 1st, 2019. Smoking is prohibited in all restaurants and other venues, including the outdoor vendors. In addition, according to the Tobacco Control Product Amendment Regulation issued in December 2018, smoking is prohibited. Dining place is defined as any place inside or outside of the building where food is prepared, served or distributed, including the former, in any room or area of a ship or train when preparing, using or selling food. By inserting the picture and health information into the box, the community is educated about the effect of smoking so that people can choose not to smoke. In addition to enforce this legislation, the government has also taken fiscal measures to increase taxes on tobacco products. Malaysia is often seen as the single destination for the need related to tourism and medical issues. This includes cardiology, dentistry, gastroenterology, screening, general surgery, orthopedic, ophthalmology, and plastic surgery. These hospitals are the best hospitals in Malaysia with the best performance of the latest medical equipment. Malaysia also offers the best doctor in the various medical schools, the best university and well-equipped hospital in the country as well as the United States. Malaysia Ministry of Health, or also known as Kementerian Kesihatan Malaysia, achievement. Malaysia has a very wide range of health services. The Malaysian government is firmly committed to popularising the principle of high-quality medical care. The local Ministry of Health provide the extensive network of clinic and hospital across the country. However, despite the effort of local authority in Malaysia to provide the best medical services, there are still some difficulties that have not been resolved. One of them is a lack of access to the high-quality medical clinic in remote areas.
Hi, my name is Sarah Betiatles and my matric number is 2019434126. Okay, I will tell you about the recommendation. Okay, first recommendation is addition staff in medical sector. Okay, as we know that COVID-19 attack has left the country short of the staff in medical sector. This can be seen where there are many additions in the growing medical sector with the new opening hospitals and clinics to curb this dangerous disease. The shortage of staff in government hospital and clinic is at a serious level due to the lack of additional posts as doctors, nurses, pharmacists, and other staff. This causes existing doctors to have work overtime, while nurses have to work to shift during working hours. In this continues, this will result in an increase in workload so that the welfare of the medical staff is not taken care of and it is capable of making them suffer from extreme fatigue. Therefore, if the MOH open up employment opportunities in the voluntary fund to assist the medical team in curbing the spread of COVID-19 to employment, it will result in an increase in MOH staff. This also cause this dangerous disease to be curbed at the immediate rate. In addition, the advantages of having more medical staff can also accommodate the newly opened health service facilities. In addition to being able to overcome the employment rate in our country because of this disease. Okay, for the second recommendation is increase the fund. Okay. In 2020, to keep the COVID-19 epidemic under control, it has been hotly debated in the budget 2021. Is seen as a hope for the people in providing the larger distribution of funds for the prevention of the pandemic COVID-19. Okay. COVID-19 preventive measures such as the purchase of the vaccine require substantial funds to ensure the country get effective, safe, and adequate vaccine for the people. Various types of equipment need to be added, and the existing health facilities need to be upgraded as our country may face a new wave of worse after this. Okay, not only that, this is also in preparation for the possibility of other epidemics in the future. Okay. In addition to launch the management and treatment of existing diseases or health problems. It is better to allocate a large budget to other ministries that have the health sector and frontline staff service such as the Ministry of Defense and the Ministry of Higher Education because can help the country in curbing this dangerous disease. This is because the government should spend more for the purchase of vaccine from abroad so that the percentage of vaccine accepted by the community can reach 100%.
Assalamualaikum. My name is Muhammad Arfan Afham bin Awang. I will present about the conclusion. I can conclude that the Ministry of Health Malaysia today can assist the community in improving the level of health in Malaysia while also enabling the community to have a productive economic and social life. The Ministry of Health Malaysia also assists and empower the people of our country to achieve their maximum health potential as well as teach them to recognize and appreciate their health as their most important assets and to take personal responsibility action to improve their health. To ensure the COVID-19 epidemic is under control that has taken millions of lives in such a short period of time. Therefore, we must band together as a multiracial community to assist the Ministry of Health Malaysia in combating this virus epidemic.